Chances are arthritis and other bone and joint pains won't kill you, but the immobility that they can cause may lead to things that can kill you. Things like obesity, high blood pressure, diabetes, and heart disease. Chris Weber reports that's why doctors today are placing a greater emphasis than ever on the importance of maintaining musculoskeletal health.
59-year-old Candy Riley works at staying in shape because she is all too familiar with the consequences of not doing so.
I watched my mother the last few years of her life go through a lot of health problems, and even though she wasn't overweight, she experienced a lot of difficulties with moving around from the bone loss and also from having trouble breathing. And the more I read about it, the more I realized that this is a personal choice that people can make, and I decided that I was going to do what I could do to not have those same problems.
This decade has been designated by major health organizations around the world as the Bone and Joint Decade, a time for increased emphasis on the prevention and treatment of musculoskeletal disorders.
Do you remember the cardiovascular boom 10 or 20 years ago when we realized the importance of keeping your heart and blood pressure and cardiovascular system healthy? We're now realizing that same importance for bone and joints, because as people are living longer, they want to stay active. They want to keep doing things, whether it's gardening or playing ball or doing what they used to do when they were younger or skiing. And you have to keep your bone and joints healthy to continue to do that.
Dr. RUANE says if a new pain doesn't heal in 4 to 6 weeks, have it checked out. There are a lot of new, effective, non-surgical treatments available to alleviate the problem. Try not to let the pain become chronic, and by all means, don't assume that it's something that you'll just have to learn to live with.
Pain can be part of a vicious cycle, and the first thing that happens is you do decrease your physical activity, and physical activity is the cornerstone of good health. Good health habits actually cluster around activity. People that are active live safer lives, they live healthier lives, they eat better, so physical activity is very important. And if pain starts to undermine that, other problems go with it, and you can eventually develop, become overweight or develop diabetes, high blood pressure, and then ultimately heart disease.
And don't underestimate the mental and emotional value of good musculoskeletal health.
I think that it makes you feel better about yourself. It increases your self-esteem. You feel as if you're being proactive. You're doing something to help your health. You're not just allowing things to happen to you.
In the next 20 years, arthritis is expected to reach epidemic proportions in the United States, affecting some 60 million people. It's already the 4th leading cause of health problems for women worldwide.